Hey guys, Dr. Sandy with another health thought, health philosophy that I want to share with you. I've been practicing for 15 years, and the conclusion I've come up with is as chiropractors, as a camp, generally speaking, most chiropractors are very passionate about natural living. Brain and nervous system and the spine need to be healthy. We need to have good nutrition and exercise, and we know that kind of stuff. And then sometimes there's a temptation to say, oh, there's never a time and place for drugs and surgery. There's never a time and place for these kind of procedures. And actually, I can tell you after 15 years of practice, I think that's a very extreme view. So I think there's actually a time and place for everything, but I want to clarify the difference. So when I see something like injections, drugs, surgery, to me, what I'd like to call that camp is stability care. And I don't know if healthcare is the best word for me, but I think it's stability care. So what we're doing is let's go in, we're going to do a drug intervention, injection or surgery, and we are trying to save someone's life because if they do not do this, they possibly could pass on. So extreme blood pressure, someone had a heart attack. I think where medicine shines is crisis management. So our objective at that point, the hospital's objective, the doctor's objective at that point is just let's stabilize this person. And that's where kind of the responsibility is. They want to stabilize them. And now let's go with that scenario. Let's say someone's had a heart attack, extreme high blood pressure. So, they got the medication, they had the intervention. They are now, quote unquote, stabilized. Are they as healthy as they could be? I think there's a lot of room for improvement. So now that the body is stabilized, they're working with their doctor, maybe they're on a prescription medication, they had a stent put in, something was done of that nature. Now what you need to do while you're doing that and working with your doc, you need to do things for health promotion. Health promotion is now saying, okay, I got this going on. What am I doing to make my body stronger? So number one, absolutely taking care of the brain and nervous system. The number one job of the nervous system, it's constantly trying to improve function and healing. So to me, obviously, if someone's sick or traumatized or something's happened to the body, of course they need to keep that open. And even as a preventative point of view, you want to have the nerves working the way it should. No pressure on the nerves is better health. It allows the body to repair itself. It's plain and simple. I mean, you can have optimal nutrition, optimal fitness, but if there's stress on the spinal cord, you will not be at that full potential. The body can still have health issues. So while that person has that going on, of course, take care of the brain and spinal cord. Also, whatever level they're at, again, working with their doc, some level of fitness. For some people, it might be just going for a walk in their house. And as they get stronger, they can do more activities. And if they qualify, going to the gym and things like that. And then obviously there's no question, anyone who's on this planet has to agree that eating good foods equals better health. And these are things that are health promoting. And wouldn't it be nice if, let's say there's a scenario that dream would be they take care of the spine, amazing fitness, amazing diet, and they're able to maybe get off the medication. Let's say that they do these things and they don't get off the medication, but they're on a lower dosage. Let's say they can't change the medication, but man, you're telling me if you take care of your spine, you're exercising, you're eating good food, it's only going to be a good thing. And you know what? Maybe there's been damage to the heart if we're going with that example. But let's protect the other organs. Let's make sure those kidneys are awesome. Let's make sure the liver is awesome, and we should be doing health promotion activities. Here's another difference too. Stability care is for when people are purely sick. When there's a huge intervention, we need the drugs, surgeries, injections, we're trying to stabilize the body. What's different with health promotion, you could say, you know what, I feel pretty darn good, and you could still benefit from getting a chiropractic adjustment to make sure that the nerve signals, the brain and body are talking. If you feel amazing, you can still say, you know what, I should exercise just to go to that next level, to have more energy, better immune system, help, keep my brain working the way it should. If you feel amazing, I think we can all agree what's wrong with having a better diet, eating more vegetables, having more fruit, eating more fresh food, just to make your body as strong as possible. Man, this is a gift from God. This is something we should appreciate. It's a temple. We should take care of it. So what's wrong with doing that? So really in my mind, I don't think there's sometimes there's a good guy, bad guy. No, these are just two different things. We need both systems. Let's be real about it. There's a time and place for crisis management, but health promotion, what's kind of different, it's for the whole population. Little kids should eat good and exercise, and they should have the spine checked. Older people should have the spine checked and should be exercising and diet. It's for everyone. Health promotion is saying that whether I'm sick or well, these are activities I'm going to do to ensure I have the highest quality of life possible. Stability care, which is the drugs, surgery, injections, is only exclusively for people who have fallen apart, crisis management. If someone went to their doctor and said, I feel wonderful, there's no way the doctor would say, and if everything qualifies, if they have a great blood report and everything's great, there's no way the doctor would say, well, you know what, let's just give you some medication. You're perfect. Your blood scores are perfect. You feel wonderful, but let's go for that surgery. You don't probably need, it wouldn't happen. It doesn't make any sense because that's a different category. That's stability care. But if for health promotion, you need to also, here's another way to look at it. You need to have a team of people who are helping you. So for crisis management, for things going on like that, or for stability care, as I said, you're working with your family physician, making sure, things are okay. But then you need other people on your team to say, okay, who's guiding me with health promotion? Because most doctors, and it's exciting to see this too, even in medicine, they're getting more open and saying, hey, yeah, you know what, there's a time and place for nutrition, and they're starting to offer classes. But if you really, it's just not their main designation. They'll probably say some general things like eat good, you should try to exercise, but it's just not their focus. I think that's the word I'm going to use. So where you need to go for wellness, for health promotion, for saying I want the best quality of life in a preventative model. I don't want to wait till I fall apart and there's a crisis. What can I do not to live in fear? Because some people are, I've met some people who are like, well, I feel good, I'm not going to do anything, it ain't broke, if it ain't broke, don't fix it kind of philosophy. No, man, and then here's what I've also seen in life is when you take action, fear just kind of disappears. So if you're saying, okay, I'm feeling pretty good or I'm not too good, but I'm going to start doing the 3 healthiest things I can do, brain and body connection through chiropractic, I'm going to start exercising whatever my body will let me. I'm going to start eating and making better choices. Man, you're in a better paradigm. You're a role model for your family, and you're actively involved with care. You are proactive. Stability care is more reactive. Something's gone out of control, and we're trying to stabilize. So both things are awesome. We need everyone. It's a healthcare philosophy. It's a healthcare team. I just wanted to make that clear. So I hope that helps you guys. Stability care is there, drugs, injections, surgery, last resort, it's out of control. We need that, but what your responsibility is hooking up with a chiropractor where the brain and body connection is flowing, good fitness, good nutrition is your responsibility. Whether you're sick or not, these are things you should be doing on a regular basis to have that highest level of health. Hope that helps you guys. God bless. I'll be here again with another health tip.